On behalf of the Association of Medical and Dental Graduates, it is my great pleasure to welcome you back virtually to RCSI for the 2021 Alumni Gathering. This is the weekend that many of you were due to join us in person here in Dublin, to reconnect with old friends and classmates, to reminisce on your experiences since graduating from RCSI, and to reflect on where life has taken you since graduation. Unfortunately, a face-to-face reunion was not to be this year, although we remain hopeful for a bumper reunion event in 2022. However, to mark the occasion, the Association and RCSI's alumni team have put together a programme of virtual events and catch-ups. We sincerely hope you enjoy the weekend, which will commence with a short reflection on the past, present and future of RCSI, led by Professor Ronan O'Connell, President of RCSI.
The Royal College of Surgeons in Ireland has a rich and illustrious history, dating back to 1784, when it was established on foot of a charter granted by King George III. While initial meetings took place in the boardroom of the Rotunda Hospital in 1805, RCSI took residence at the corner of York Street. This fabulous building at 123 St. Stephen's Green, that many of you know so well, was completed in 1810. If walls could talk, these rooms would have some intriguing tales to tell. In its initial years, the focus of RCSI was exclusively on surgical teaching, and teaching of medicine did not begin until 1813, when Professor John Chain was appointed the first chair of medicine and joined colleagues such as the Professor of Anatomy, Surgery and Physiology, Abraham Collis. In 1885, RCSI opened its doors to female students, including Emily Wilfred Dixon, who became the first female fellow in 1893, and whose portrait now hangs in the boardroom. The early 20th century was a time of tumult, both here and internationally, with many of RCSI's students and alumni involved in treating those injured on the front lines of World War I, and indeed closer to home during the 1916 Rising. Although thankfully violence has not revisited the college has found itself facing different challenges that have required innovation and adaptation during the 20th century. A new medical school opened on York Street in the 1970s, and RCSI became recognised as a college of the National University of Ireland in 1978. Meanwhile, in the 1980s, hospitals that many of you may have trained in, including the charitable infirmary Jervis Street and the Richmond Hospital, closed their doors, while Beaumont was opened as RCSI's principal teaching hospital. Throughout this time, RCSI continued to advance pioneering technologies in medicine, surgery, and healthcare research. While on the cusp of the 21st century, the college expanded to include two new undergraduate schools, the School of Physiotherapy and the School of Pharmacy. A globally minded institution from the outset, RCSI expanded its horizons with the establishment of satellite campuses in Malaysia and Dubai, as well as welcoming the first cohort of students to RCSI Bahrain in 2004. This global outlook was reflected in the partnerships with the College of Surgeons of East, Central and Southern Africa, and more recently in the launch of the Institute of Global Surgery. 235 years after its establishment, RCSI became Ireland's first not-for-profit independent university in 2019. The history of RCSI is rich and thought-provoking. It reflects the pioneering spirit and sense of innovation that has been at the heart of the college since its inception. It provides you as alumni with a tangible tradition, a shared identity that spans the decades and will have shaped your practice and achievements since your graduation. It also presents a very high standard to which we all aspire.
Thank you, Professor O'Connell, for sharing that reflection on the history of RCSI. As I often say, we truly are standing on the shoulders of giants and building on the achievements of our predecessors. Developing our theme of past, present and future, and I will speak to the present and our present situation. While some of our predecessors may also have faced challenges on the scale of the current pandemic, in fighting COVID-19, we've been able to benefit from advancements made in research and technology like no other generation before us. Just to give you a flavour of that, I'm delighted to say that researchers from RCSI have played a significant role in this regard and developed the Dublin-Boston score that can accurately predict which patients will develop a severe form of COVID-19. Our professors are leading out on the first investigational medicine product trial to be approved in Ireland to test a therapy to treat COVID-19. And thanks to a major grant from 3M, our researchers are also focused on additional treatments and insights for vaccine development for COVID-19. All of this is a testament to the quality of research being driven by RCSI investigators today. I'm standing outside 26 York Street, home to the Centre for Simulation Education and Research, the most advanced clinical simulation suite in Europe. We're privileged to have Professor Walter Epic as the Foundation Chair of RCSI Sim. The importance of technology was reinforced through the pandemic, and while we strive to ensure that our students continue to receive face-to-face teaching and experience, IT enabled our students to learn remotely where necessary. Although the solution was far from ideal, we witnessed the class of 2021 record some of the highest exam results we've ever had to date. In this regard, I want to take the time to thank you, our alumni, for the ongoing support you've shown to our students during this period. From those of you who acted as online mentors, to the many alumni who sent through messages of support, as well as the alumni who contributed financially through scholarships and by supporting appeals, we value the time and support of every single one of you. Thank you. Gandhi famously said that the future depends on what we do in the present. In looking to the future, I'm now delighted to introduce our Dean, Professor Hannah McGee, to share her thoughts on that with you.
Thank you, Cathal. Standing here in the new building on 26 York Street, I am reminded that change is inevitable. I know that many of you may never have had an opportunity to avail of these fabulous facilities. In fact, some of you may never have set foot in this building, as it has been some time since you came to visit us in Dublin. This building is not the only change to have happened in recent years. Beyond York Street and around the Green, we've seen many additional changes. The opening of the Museum of Literature Ireland, which backs onto the Ivy Gardens, is a new and welcome addition to the neighbourhood. The appearance of rental bicycles along most sides of the Green has also given us a very continental feel. Indeed, the introduction of outdoor dining in the last few months has only added to a very hopeful atmosphere in Dublin, although the mood can occasionally be dampened, quite literally, by the rain. Within RCSI, we are also looking to the future. We have ambitious plans to develop RCSI's Med District further through Project Connect, which will see the construction of a 10-storey building on St. Stephen's Green, which will become the hub for RCSI's global wellness initiatives. We also have plans to develop our clinical teaching sites, and Connolly Hospital is the immediate priority. Separately, we will continue to build on two important new initiatives driving our reputation and ranking internationally. The recent establishment of the Centre for Positive Psychology and Health, which is chaired by Professor Kieran O'Boyle, and RCSI's Institute for Global Surgery, chaired by Professor Mark Schrein. While change is inevitable, I am struck by the fact that some things remain constant. For RCSI, we always have an eye to our heritage, and it is fitting that the plans for the School of Population Health are being progressed in the centenary year of the death of Sir Charles A. Cameron. A tireless campaigner for better hygiene, health and welfare for the City of Dublin and its people, Cameron's research and publications led to improved public health across this city. It was fitting, therefore, that this year we were able to bestow the inaugural Cameron Award to Dr. Mike Ryan from the World Health Organization. For faculty, alumni and students, I am struck by the fact that we are truly privileged in our experiences of RCSI as a place of learning that is shaped by its past, thriving in the present, and hopeful for the future. A time when we look forward to meeting you all again in person.